We're moving on now to our next presentation, and it is coming to us from Canada. So there is no need to move to other rooms, and I think we're all about to become virtual. So our virtual audience is now virtually virtual, because our presentation is coming from another part of the world, which I think is a really great indication of why we're all here. Dr. Snowdon, a professor, strategy and entrepreneurship, scientific director and CEO at Scan Health, will provide an international perspective on the role of clinical governance in advancing digital health transformation in global systems. Please welcome Dr. Snowdon.
Thank you all very much. I hope you can see me and hear me. Yes, hopefully. I will just share my screen then and get underway. I am absolutely delighted to have a chance to speak with you today from quite a bit further north than where you are. I am joining you today from the University of Windsor, which sits on the traditional territory of the Three Fires Confederacy of First Nations, which includes the Ojibwe, the Odawa, and the Potawatomi. We absolutely respect the many long-standing relationships with our First Nations people in this place in the 100-mile Windsor-Essex Peninsula and the Straits of Detroit. It is much cooler where I am than where you are, so I certainly envy the time of year you are enjoying. Let me begin with the whole question of clinical governance and set the stage by where health systems are today and where we have come from in the last 2 to 3 years. Many would suggest, with COVID pandemic being hopefully behind us, the tectonic plates of healthcare have absolutely shifted. A number of these you reference and you noted in the last few minutes of discussion. No question, very sustained increased demand and expectations for care in a number of countries, Canada being one of those. People are waiting longer, and they are becoming more ill before they can access care, given the many delays that they've endured over the last 3 years. Workforce sustainability, no question, I'll touch on that in a moment. In digital health transformation, we talk about the absolute critical importance and centeredness of the patient and the care delivery. I would also suggest it's that partnership and that engagement of patients with their provider teams and ensuring that provider teams have environments that can easily and have a quality of life in a very digitally enabled environment. We'll touch on the issue of technology and technology at scale, the many incredible technologies that advance far more quickly than health systems are able to advance them, and the many continued global supply disruptions that continue to plague our care system. So here's a quote from, I just happened to see in The Economist magazine, that captures where they think why health services are in such chaos everywhere. They suggest that COVID weighs less heavily on people's minds these days, yet healthcare systems in much of the well-developed world are closer to collapse than at any point since the COVID pandemic has started to spread. That is heartbreaking when I really think about it. I'm a nurse by training, and to suggest that our systems are nearing collapse or far worse off than they were even during COVID is concerning. They identify a number of indicators you can see on this screen. Wait times, certainly in the UK, have quadrupled. In Canada, we have never had wait times as long as they are now. In Italy, the wait time for a non-urgent breast ultrasound is up to 2 years. And you can see Switzerland, Singapore, same thing. In fact, the International Society of Quality and Safety in Healthcare is identifying that quality and safety outcomes are poorer today than they were even before COVID. So we have a lot of work to do. Digitally enabled digital transformation that you've been addressing at your conference plays a critical and fundamental role. And I'll touch on just a few of those areas that link to the critical importance of clinical governance. You showed a story of Oscar and his family, and really it profiles with many of the stories we are seeing globally. that citizen engagement and citizens generally have quite a shift in their expectations on health systems, which are placing phenomenal demands on a system already facing many challenges. The lockdowns we all endured for exceptional lengths of time really impacted our quality of life. We're seeing the behavioral health impact, particularly in our young women, which have 20 to 30% higher incidence of challenges than their male counterparts. Very rapid shift towards families, communities, citizens having to simply manage their health and wellness because health systems were so diverted to managing the COVID pandemic and the many, many patients that system was faced with. At the same time, we had no digital enabled tools generally scaled at the country levels or even regional levels where our citizens could connect to our provider teams meaningfully using digital tools. If they couldn't see them in person as they normally would, there was really relatively limited access to provider teams digitally. And that's really set a new set of expectations on many, many health systems. What became painfully clear over the last number of years, when you look at health as a business sector compared to all the other business sectors like retail, banking, airlines, all the many systems, education that consumers engage in, healthcare is really not a meaningful part of the digital societies we all live in, and yet we absolutely need to be, and we need to be there much more quickly than we have in the past. Let me switch to the impact on our workforce. This is a graphic out of the NHS that describes the amount of paperwork required for a physician to admit a patient to hospital in the UK. A colleague of mine in the US shared with me that for a nurse to chart where a patient's belongings are stored on admissions required 52 clicks in the EMR. She was horrified by that as chief nursing officer, and she was thrilled to report to me that now she's got it down to 31 clicks. I think we really have much work to do to look at the role of our technologies, the amazing and incredible things those technologies can achieve, but are we really also balancing those with the quality of work life when we ask our clinicians to work within these digitally enabled environments? Technology has been critically important and will be all that much more important moving forward. The critical question, though, is technology and our procurement of those technologies focused on digitizing today's healthcare system, or is it really focused on achieving the future digitally enabled person-centric health system that you've all spoken about so often today in your program? The focus and the limited adoption of technologies at scale, the impact, of course, on workflows and quality of work life, critical. And I noticed there's a graphic here from the world's best smart hospitals. This is a typical competition you see, and when you look at the kinds of things they measure, they are not measuring what those technologies achieve. Rather, they are measuring what technologies health systems have. Until we start to look towards and to really critically examine what can we achieve, what technologies will help us get there, I think will limit our perspective in terms of advancing digital health transformation. And of course, I'd be remiss if I didn't profile and identify the disruptions, almost unprecedented in magnitude and scope, but the continued disruptions of global supply chains. In Canada, like Australia, we're a very large land mass, relatively small population, spread out all across this very large border with the US. We today, and Health Canada, have 1,036 drugs that cannot be accessed because of supply chain disruptions. And those are just the drugs, not the supplies, not the sodium chloride vials, and the many other challenges. This will be a continued and escalating challenge as we see climate disruptions, whether it's floods, hurricanes, fires, tsunamis. And yet, when I look at and examine healthcare systems from a digital perspective, digital capacity, our supply chains continue to be relatively manual, not terribly resilient, and most definitely not proactive and able to identify the risks of the many disruptions we're facing. So that's just another piece that really poses a significant challenge for how and where we're able to engage and support patients and families we deliver care for. So what is the role of clinical governance? Clinical governance is fundamentally the platform by which digital transformation unfolds and proceeds. It creates the visibility and the transparency. Visibility and transparency all by itself builds confidence, not just among our patients and citizens and families, communities, but also our health workforce. It creates accountable, measurable priorities and outcomes to move towards. If you don't have clinical governance, then you're missing the very, very foundation of what it means to transform towards a more digitally enabled person-centric healthcare system. What does it mean and what does it require to advance and be supported in digital transformation efforts, leveraging clinical governance? It means three things: measuring what matters, tracking progress to those measurable milestones and outcomes that have been prioritized, those strategic priorities, and creating the environment for learning and partnerships. It will take all of us, not just our health system leaders, clinicians, patients, families, our colleagues in companies with those technology expertise that help health systems start to begin to define what is the future health system that's meaningful and a meaningful part of the digital societies that all our citizens live in and need health systems to be a meaningful part of as well. It'll have a very specific change and shift in our procurement. How do we work with our suppliers, vendors? I'm not sure the word that's most appropriate in Australia, but how do we work with them as partners? Not just to buy and purchase technologies or maybe co-design them, but how do we envision what the strategic priorities are of an organization, how digital transformation helps us to achieve those strategic priorities focused on measurable outcomes and impact that engages and for sure supports our workforce in not just digitizing the care we deliver today, moving from an in-person visit maybe to a telehealth visit, but reimagining care delivery that's digital enabled. So if I'm that patient, I have my own digital tools in the palm of my hand. I can connect to my providers, whichever providers I happen to be working with. They know how I'm progressing to my goals, as well as I know how what's working well as I progress to my health goals. And we can both identify times and situations where we may be at risk. We can mitigate those risks and support and enable health and wellness rather than focus where we have been for so many decades on disease management. Clinical governance is all about choices and decisions. As Don Berwick wrote in a small piece during the pandemic, fate will not create our new normal, but our choices most definitely will. Governance, as I've mentioned, is so foundational. This is a graphic that really represents what a digital health ecosystem is. It's based on the work I've been doing with HIMSS in terms of mapping out what are the key dimensions of digital health ecosystems based on absolutely every definition of digital health, every framework, every model, and all the current evidence that we could get our hands on when we develop this. As you can see, the very foundation of digital health ecosystems is governance and the ability of that governance models and framework to support and enable a highly sustainable workforce. Governance is about data stewardship, accountability, transparency. These are all words you've heard about and are certainly in your clinical governance framework. It creates the evidence of value and impact and for whom, and it supports and enables workforce to be able to deliver care in very high-performing, automated, smart, if you will, digitally enabled care environments. Without governance, you can't possibly achieve interoperability, that democratization of data that flows across the journey of care, because you wouldn't have been able to achieve the stewardship, privacy, security, and all those many safeguards, if you will, that are so critical for interoperability. If you don't have democratization of data, of course, then it becomes impossible to flow data right to the palm of hand of your patients, clients you're working with, apply those analytics and help them help themselves understand, am I progressing towards my health goals, or have I not progressed and I need to change course with the support of my provider team? That's when all of those dimensions come together, that's when healthcare enters and becomes such a meaningful, important part of digital societies, where people, citizens, are able to manage their health and wellness with the support of their teams, with the digital tools and models of care delivery that work best for them. You can't possibly measure and know where you are, how to get to the next step, where your digital capacity and strengths are, and of course, unless you measure them. And this is just a quick reference to a digital health indicator tool. It's an online survey tool that just helps people understand where are our digital assets, how do we leverage those assets to go from where we are today to move towards and make progress towards that digital health ecosystem goal. What does it mean in terms of working with health systems and partnerships? Health systems in many of the case studies, the digital health research I've done for a number of years, has revealed very clearly that health systems don't have all the answers. We need the partners, we need the expertise of our colleagues that are in many important companies that are advancing those digital tools and technologies that help health systems go from today to a much more digitally enabled ecosystem. Clinical governance plays this critical role because it defines the value and the strategic priorities and outcomes that technologies must achieve. That starts to shift how do we work with our partners in technological companies, suppliers, vendors, whatever the term is that makes most sense. How do we shift towards helping procuring not just purchasing a technology, which I see a lot, but purchasing and engaging in a partnership where the roles of the partners are clearly defined. The outcomes that the clinical governance models and accountabilities are articulated are measurable, and they are tracked over time so that both those technology providers, those health system leaders, our clinicians, teams work together to achieve the goals of advancing digital health ecosystems. Unless and until we move from purchasing those technologies or rewarding the many technologies that are in place, and we shift towards what outcomes are those technologies enabling us to achieve for whom, under what conditions are those outcomes exceptional for some of our patients, perhaps not quite as exceptional for others, and how do we then shift and with a great deal of agility start to tailor our care delivery models, digitally enabled as well, in order to meet the impact and value of every citizen everywhere. And that's actually essentially the challenge we all face in most every country around equity. So if we're wildly successful, clinical governance sets that important platform, we're able to advance those digital transformative changes in health systems, not just digitizing today's care, but reimagining care in very digitally enabled environments that meaningfully connect to patients. What would we see? What would we look like? One of the things we would see is a shift from where many health systems have been for a very long time, react and respond. It's somewhat retrospective. Our patients become ill, they come, they see their provider, those providers do a phenomenal work, help them get better, or in the case of a chronic condition, help them manage that chronic condition. Imagine the health system that doesn't wait for those illnesses to show up. They can predict and act and proactively identify who's at greatest risk. How do we mitigate those risks? How do we help people help themselves with digitally enabled tools to reach their health and wellness goals and support them along the way when and where needed? So that's one of the hallmark features. A second one that you've mentioned, of course, every health system, if there's one thing I have seen shift since the pandemic and the work we're doing with many countries, it's this renewed thank goodness, focus on equity. It is no longer one size fits all, which is equality. Everybody has access to the same care routine. What's really important now is what matters to that individual person and or population or unique group you're working with, and what are the key dimensions of care that are most meaningful to that group or to that individual to help them achieve what they see as valuable and important in their very unique circumstances. Like Australia, Canada, with our Indigenous populations, the care delivery pathways, if you will, or the types of care those communities need is vastly different from the care models that you would need perhaps in inner city Vancouver or Toronto or a small rural community in the far north. So it's not just about equality anymore and access to care. It's about health systems tailoring and focusing their care delivery to the unique life circumstances of every individual, every community, so that every person everywhere has the chance to realize their full health potential, but they may get there differently than the person beside them. So to close, what's a future health system, a digitally enabled ecosystem really about? It's a learning health system. It's very data driven. It focuses and understands and tracks in real time population health outcomes, what's working for whom, what's not working as well as we had hoped, and how do we pivot and with great deal of agility, shift towards ensuring every person, every community has the opportunity to achieve best outcomes. They're informed by design and scalability of new care solutions, entirely driven by flow of data in near real time, so that we have a predictive and proactive system that can implement new models of care, test them, make absolute sure they're achieving value for the individuals and groups they were intended to. If not, pivot and shift. If they are achieving value, scaling those models across to the populations that make the most sense. Again, constantly being informed by data. Are we achieving those outcomes with those very transparent and visible accountability systems that the whole system with their partners in the private sector can move forward and move towards a future digital health system that's sustainable, it's equitable, it has a very high performing workforce that has those support systems. They don't have the 52 clicks to chart something very, very simple. Working in digitally enabled environments that are as meaningful for our clinician teams as it is for the patients who receive care. With that, I am absolutely delighted to have had a chance to share this work with you. Very happy to entertain or take any questions that might be helpful.
So do we have any questions to kick things off from in the room? We potentially also have some from Slido, which I'll read out, but I can't actually see them right now. Does anyone have a question to kick things off? Yep.
Can you hear me if I ask the question? Fabulous.
Yes.
Super with fantastic presentation. I'd love to get your insights on how Australia can move towards what they call in Canada a 4P model of care: preventative, participatory, predictive, personalised. Is it some of the steps you've outlined or something else we need to consider?
To some degree, what that model, it does touch on what I've outlined, that those 4 dimensions, in order to pay for, and those dimensions you mentioned, you have to have data flow to identify what outcomes you're achieving for whom. If you don't, then I'm not sure how you would actually be able to execute all of those pieces. And certainly the funding models vary in every country. But if you have data and you have near real-time data, it's not, one of the issues in Canada right now, for example, is during COVID, there was a 9-month delay in data flowing from hospitals to our national agency to analyze and then, of course, share with health system leaders to understand where and how we could improve. That data needs to flow in real time. It needs to flow across systems, not just within unique organizations. That's the whole question of interoperability. But then you have to have that incredibly strong clinical governance framework, because if you don't, then the privacy, security, and cybersecurity issues are an exceptional challenge. We had an entire provincial health system shut down completely, go to manual everything, and paper-based because of cyber attacks. So it is really those four dimensions, starting with the clinical governance, interoperability, then applying the analytics, and that's what finally gets you to that person-enabled care. But it can be a long road. I hope I answered that question.
A question here from David online that asks, do you ever see international interoperability and commonality of standards? Do you see that in the future?
I would love to see that in the future. I have not seen that yet. We are very much at the point, the one silver lining of the pandemic is the renewed attention to standards. But where I'm seeing it is primarily standards within countries. So in Canada right now, debating on how do we implement standards so that every province and territory is using the same standard. I have not seen, unfortunately, country to country level standards, but that in fact would have been phenomenally helpful during COVID as different countries were experiencing that pandemic as it unrolled. It might start, if it's going to start country to country, in the public health domain, because so much of the disease transmission was so critical at country level data. But unless you have country level standards, then it's exceptionally hard to roll up to country level standards. But it is accelerating. It does have much more attention than I've seen pre-2020.
Thank you. We probably have time for one more question.
Thanks for the description of how things are working in Canada. I work in a remote area myself and with Aboriginal populations here. And we currently suffer great workforce shortages across our region and through other parts of Australia. How has Canada addressed this, particularly when you're talking about data clinician type positions potentially to help steward the use of data in remote locations for small and medium-sized organisations, for example, who deal with quite complex data structures, and then getting that to flow back into the broader structures you're talking about? Are there any insights that you might give at how we might address that here in Australia?
I think we have so many commonalities with you in that very same space. What we're finding is certainly the flow of data and the digital infrastructure in our First Nations communities are profoundly underdeveloped. There are many in the very far north, the fly-in only communities, that actually don't even have bandwidth. So it's not even a matter of data. It's, do you have any data infrastructure, internet capacity, if you will? Where we are seeing progress is where our First Nations communities take the lead and they decide the strategy, the clinical governance, if you will. They wouldn't call it that, but the governance model, the accountability structures, and they define what is of value to them. And that tends to be what's been much, much more progressive and moving forward than when a province, territory, or in our case, it's a federal government jurisdiction to deliver healthcare to our Indigenous communities across the country. So the complexity there, you can just imagine, between federal government jurisdiction, provincial service delivery models, and then the unique values and needs of each community. So it is, we have a very, very long way to go. Where I'm seeing progress and some very impressive findings is when the First Nations communities come together, they define the way forward, and then they partner with, whether it's their government colleagues and or industry, to achieve what they've decided is of most urgency and of greatest value to them. But I don't want to suggest we have made a lot of progress. We have a long way to go. Their health outcomes, profoundly poorer than the average non-Aboriginal Canadian.
Please join me in thanking Dr. Anne Snowdon.
Thank you so much for having me. It's a pleasure to join you.